You touched a little bit upon the neuropsychologist's role in recovery and treatment. Could you go into some detail about that? What's your job and how do you do it?
Yeah, so, once again, pattern analysis, we're looking for the strengths and weaknesses across all of those different functions. And the easiest way to describe that field is to say that, one of the things that we try to do, the easiest thing actually, especially with today's technology, is compensation. So think about it as a crutch. Like if someone has a knee replacement, they can get around, but they need a cast on their leg and a crutch. Example of that is, I was working with a professor a very sort of professor with some notoriety and popularity in the Philadelphia area, and who had a head injury. And he was in his 60s. He was able at this point to stand up and give a lecture, to 200 students with no problem until his head injury. So the compensation device that we used, because he wanted to continue to teach, is that now he had to use slides, whereas before he could just extemporaneously get up and he might use a few slides. But now the problem wasn't his memory, because what he was talking about was long-term memory, not short-term. The problem was his frontal lobe in terms of inhibiting him from going off on tangents. He would go off on a total tangent, and 10 minutes later think, oh my God, where am I? Having trouble finding his place. So we had him develop a slide presentation and use that slide presentation and talk from the slides. It's not changing anything about the way his brain is doing it. The changes are external. The changes are in the environment, right? Much like a crutch or a wheelchair. In terms of what happens inside the brain, I would say generally there are two categories of things we try to do. One is to try to exercise that same brain region that's impaired to get those neurons to get closer together, right? The more you work that area, the more blood flow goes the more you exercise that area, the more blood flow gets to that area, and it's helping those neurons heal. So in the example of a concrete example would be, one of the common things that head injury people have is word retrieval. The words on the tip of their tongue, they can't quite find it. And that would be this area, the angular gyrus of the left parietal lobe. This is where words are stored. Left side in the rear. So this is kind of the library. This is the stacks of the library where verbal information is stored. It has to go up this pathway called the arcuate to the frontal lobe where it's actually spoken, right? So if a person has trouble with word retrieval, a speech therapist might give them pictures of different objects and have them try, more and more esoteric objects, less common objects, and have them retrieve the name. It just as a way of exercising, like you would, like if your arm came out of a cast, you would be exercising your arm. The other way that's a little bit more complicated is finding a different brain region. If this brain region is really impaired, let's say the area between the angular gyrus and the frontal lobe, the arcuate fasciculus, that's like a highway that connects these two areas. Maybe that's impaired, right? So we have to find a different brain region. So that's the area where I feel like we can be most creative, because as I said before, people who are really, really good at things learn how to use innately. They use other areas of their brain that most of us wouldn't even touch to get that thing done, but it has the potential to do it. So, to give you an example with a short-term memory example, which is, probably the most commonly reported symptom of, TBI. If I ask you to remember 4 words, let's say house, tree, cat, pie, how would your brain process that? How would you try to remember that?
In school, I would use initials.
Okay. No, that's very good. Yeah.
HTCP.
HTCP. Right. Now you have to remember those.
It's
Yeah.
true.
Right. And sometimes people would make up, well, that's like HTCP, like ketchup, or it's thinking of some word that contains those. So it's one, so it's easier. Some people would do verbal rehearsal, house, tree, cat, pie, house, tree, cat, pie, house, tree, cat, pie. That's using the left temporal lobe, right? That's verbal memory. But if I asked you if the left temporal lobe is impaired because of an injury, if I asked you to just picture in your mind's eye a picture of a house with a tree in the front yard and a cat sitting on one of the branches in the tree, and maybe a blueberry pie on the front porch cooling off, right? Take a snapshot of that. Then you're using a totally different region of your brain. You're using the right temporal lobe, responsible for nonverbal memory.
Because my brain is recreating that picture
Right. You just have to pull up that
in my
picture.
mind.
Right. I tell people all the time, say, a guy will say to me, my wife sent me to the supermarket to get 4 things. I can't believe I forgot one of the things. And she tries to tell me to take make a note, and I don't want to do it because it's so easy. I know I can do 4 things. And, he comes home with 3 of the 4 things. I say, just take a picture of those 4 things on the belt, the checkout counter. Just take a mental snapshot of what those 4 things are going to look like, and then you got it. You got it. Because it's using, a totally different region of the brain that, based on my testing, I know is less impaired than the left temporal lobe.